Hi, welcome to Health Psychology. My name is Dr. McMillan and I will be your professor for this semester. What I'd like to do today is give you a basic introduction of health psychology as well as an overview of my expectations for this class and for this semester. I'd like to begin with a basic highlight of what I intend to cover today. First of all, I would like to focus on the website that I've set up for the course, and then say a few words about the lecture slides, go over the syllabus, and then give you an introduction to health psychology. I've set up this website for the class, and it's got lots of different materials on it. I'll start off on the home page, and I've sent this link out to the class, and I'll send it out again in an email later this evening. But I want to walk you through the course site. This is a Google site. It's available to anybody in the world. You don't have to sign up for Google to use this site. There are features that you can use if you have a Google account that you may find useful or not. Basically, it will email you anytime I make a change so that you can know when there have been changes to the website without actually having to go to visit it. But first of all, on the home page, I've created a class blog. Really, all this is clippings of news articles that I think are relevant to course material. These are not required reading, although I will probably ask bonus questions on the exam that will include information covered in these snippets. The next section is a contact me section. If you have a question or a comment about class, you can use this form. You can also just pick up the phone or send me a traditional email. Bio sketches here if you're interested. I've set up a class calendar as well. This calendar has my office hours as well as the topic material for each class. And if you click on it, you can get more details and see actually details about the class. You're seeing it, unfortunately, you're seeing it as what my view rather than as your view as the instructor. But so let me get back to the course website, and I have a reading list, and this is an important aspect of the website. Basically, for each class, I will put the supplemental readings that are in addition to the textbook, as well as my lecture slides will be available on this website. So for each class, there will be several readings or slides that I expect you to look at before class and to read if it's a reading. And you'll see that some of my notes, occasionally I say read the executive summary. I kind of tell you don't have to read the whole thing, but here's what I want you to pay attention to. Other times I say it's a resource, meaning you don't have to read it, you won't be tested on it. I'm just including it because it's something that you might find useful. Next section is useful links. These are links that I think would be useful for anybody taking the class. The YouTube channel. This is where I'm including several different video snippets of things that will enhance the lecture. I may show you some of these in class, or I may assign some of these as homework. Also, in the instance of today, I will put the lecture on the YouTube channel. One more word about the reading list. For each class, I'm going to put the lecture slides available. These are the slides that you're seeing in front of you during a normal lecture that I'm projecting with or showing on the overhead projector. These lecture slides in and of themselves are not sufficient for studying for the exam. I provide these so that you don't have to try to write down the charts that I put up. Also, I want to provide the students with an outline of where I'm going with each lecture, but again, you're going to have to take notes to do well in this exam. These lecture slides by themselves are not sufficient preparation for the exam. Next, I'd like to actually go over the syllabus for this class. As it loads, I'll say just a few background things about the class. Bring your attention to the honor code. Mississippi State now has an honor code, and you're expected to adhere to the honor code. Also, Mississippi State has a policy against using cell phones and computers in the classroom. Basically, I find it distracting and inconsiderate to see students texting while I'm in class, and I will penalize 5 points from each student each time I see them texting in class. So please do not push me on this area. The readings, you have a required textbook. I've provided you with the ISBN number. You can get that book however you see fit. Also, there will be additional readings posted on the course reading list. Grades, fairly straightforward. Class participation and attendance is 50 points. Your exams each count for 100 points. I may give a pop quiz occasionally. If I do, it's for extra credit. Exams. There's 4 exams. Each exam will consist of multiple choice questions that come primarily from the textbook and short answers that come primarily from lecture and the supplemental readings. I do not give makeup exams. If you miss an exam, you'll take a 0 on that exam, but I do drop your lowest grade assuming you take the optional final. The way this works is if you miss an exam for whatever reason, you can then take the final on the day that the final is assigned by the university. It'll be sometime in early December, and I will replace your lowest grade with, and if your grade is a 0 because you missed an exam, that'll work. Or if you've done really well on 3 exams but done poorly on another one, you can take the optional final, and I will replace your lowest grade. If you take the optional final and that ends up being your lowest grade, I'll drop the final as your, so it can't hurt you to take the final. One last word about exams. If you have an academic or athletic reason for missing an exam, such as that you've got a football game, soccer game, or some type of academic conference, let me know now about that, and we can make arrangements for you to reschedule the exam. If you come to me the day before the exam and say I have to go to this event, I'm probably not going to be very sympathetic, but if you talk to me this week or early next week, we'll set up something so that you don't take a 0 for missing the exam. If you have any questions, bring this with you to class on Tuesday the 24th, and I'll be happy to address any of those questions. Okay, back to the lecture slides. I want to give you a brief overview of health psychology. I'll cover this material in more detail in class on the 24th, but I want to give you today a basic introduction to health psychology. If you look at the leading causes of death in 1900, you see that it was diseases like pneumonia, tuberculosis, and diarrhea were the 3 leading causes of death. If you think about it, these 3 leading causes of death have several things in common. Basically, these are all diseases that you can get from somebody else or from some kind of organism. These are infectious diseases, in other words, caused by some kind of microbial agent, whether it's a virus or a bacteria, that causes an illness, and if we're lucky and fortunate, our infectious system will fight that off and we will get better, and if we're very unfortunate, it could lead to death. But as you see, in the 1900s, the leading causes of death tended to be these things that were infectious diseases. When you get to the 2003, you see a very different pattern. The leading causes of death are heart disease, cancer, and stroke, followed by chronic lower respiratory diseases, injuries, diabetes, and then finally influenza. So you have to go down all the way to influenza before you get to a disease that's actually infectious. You don't get heart disease from another person. You don't get it from a virus, and the same is true for cancer, stroke, chronic lower respiratory illnesses. Diabetes typically has a genetic component as well as a behavioral component, and injuries quite often have to do with lifestyle and behavior as well. So what you see over the 20th century, is a shift from diseases that are caused by viruses and bacteria that are fought off or not successfully fought off by our infectious system, to people dying of what we call chronic illnesses. These are illnesses that are not attributable to some infection, but are attributable to some combination of our lifestyle, our environment, and our genetic makeup. If you have the actual causes of death in the year 2000, not the disease that killed the person, but actually what caused that disease, you see that tobacco is the leading cause of death. It accounts for about 18% of deaths, followed quickly by poor diet and physical activity. The 3rd leading cause of death is a very distant 3rd, and that's alcohol abuse at 3.5%. And then the 4th leading cause of death is infectious agents or microbial agents such as viruses and bacteria. The reason why this is so important is that it's caused a huge shift in our approach to healthcare. In the 1900s, healthcare was fairly simple and training was fairly simple as well. A physician and a nurse basically tried to take care of a person while they were trying to fight off that infection, and most medical efforts centered on keeping that person comfortable and making sure that that person didn't infect other people. Length of stay in hospitals tended to be fairly short because a person either fought off the virus or the bacteria or they died. And training was not that complicated either. The equipment wasn't terribly expensive. So for a lot of reasons, healthcare was a lot more simple in the 1900s. As we progress through the century, we see a lot of different developments. We see better hygiene, better appreciation of hygiene. So we see fewer infectious deaths. We see better training for doctors, better diagnostic tools, vaccines and drugs to fight off infection. And we see people begin to live longer, and they begin to die of these chronic illnesses that, again, are not caused by a virus or a bacteria, but by our lifestyle, our genetics, and our environment. And these are important because this change leads to changes in healthcare as well. Death through chronic illness, or I'm sorry, not death, but treating a chronic illness tends to be very costly. It requires longer lengths of stay in the hospital, much longer treatments of the diseases, much more expensive drugs, expensive treatments as well. And I'll talk more about this in class on the 24th. But we see a shift over 100 years from people dying of fairly inexpensive diseases to diseases that are much more expensive to treat and maintain and manage, and are very much attributable to our behavior and our environment and our genetic background. So we start to see a shift towards diseases in which personal responsibility really plays a large component. To walk you through a brief history of health from the 1600s to the present. From the 1600s to the 1900s, we begin to see an appreciation of the role that infectious agents play on diseases, and begin to understand and develop an appreciation for better hygiene, and life expectancy increases. But in 1900, we still saw a life expectancy of 48 years old. That's now 78 years old, and a lot of that is because we don't see, at least in the United States, infectious diseases playing the role that they did in the 1900s. Fewer people are dying in childhood of infectious diseases, and people are living longer because they're avoiding these infectious diseases. In the late 1970s, we see health psychology develop as an area of study within psychology, and it is a field that's really meant to look at the interplay of genetics and behavior and environment and how that relates to health. There are three themes for this course, and almost all semester we'll be focusing on these three, in some form or another, these three themes. The first is infectious disease versus chronic disease. And there's three issues with that. The onset and time frame. An infectious disease typically happens very quickly, and it persists. It doesn't typically persist for very long. The person either fights it off or they succumb to the disease. Whereas a chronic disease may take years, if not decades, to develop. And again, a person may survive with a manageable chronic disease for years or decades as well. Underlying causes: infectious diseases typically are caused by a virus or a bacteria. Chronic illness are typically caused by our behavior, the environment we live in, and our genetic makeup. Cost: I've already talked about this a little bit. Infectious diseases are not that expensive to treat, but chronic illnesses can be incredibly expensive to treat, especially given that they can last for decades. Next theme is the role of prevention in population health. You've all heard that an ounce of prevention is worth a pound of cure. Well, obviously, if we can prevent a chronic disease from developing, we can improve health and save a lot of money in healthcare dollars. And a large component of public health these days is targeting early detection of diseases so that we can treat them with more success, and beyond that, preventing unhealthy behaviors before they ever manifest themselves into a chronic illness such as diabetes or cancer. And then finally, social influence. This is a psychology class, and my background is in social psychology with a heavy emphasis on social influence. And if we're trying to change unhealthy behaviors, obviously social influence will play a huge role. I've said this before, but there's 3 factors affecting health, especially with regard to chronic illness. We have our genetic background. We have our social, actually these slides are goofy, I apologize. Genetic background is one bullet, environment is another bullet, physical and social environment are sub-bullets of environment. And so genetic background affects health. Our environment affects health, whether it's the physical environment we live in or the social environment that we live in. And our behavior affects our health. We can engage in health-enhancing behaviors such as exercise or health-harming behaviors such as cigarette smoking. Each of these has unique characteristics. Obviously, our behavior is very modifiable. There's nothing that says that we have to smoke or we have to eat a poor diet. So behavior is very, very modifiable. It's difficult to modify at times, but it is modifiable. Our environment is somewhat modifiable. I mean, there are ways to change the physical environment that we live in, and there are ways to change our social environment. Quite often it can be a challenge, but it is possible. In genetic background, historically that has not been modifiable, but one of the interesting things that we're seeing over the last few years is a better understanding of the human genome and emerging methods for genetic testing that can affect health as well. And with in vitro fertilization, that brings up some ethical issues with modifying genetic background as well, and we'll spend some time at the end of the semester talking about these issues. I'll talk more about this slide on the 24th, but I want to introduce it. As we have moved from a world in which we're fighting infectious diseases to a world in which we're also concerned about chronic diseases, we see that medical care involves a lot more than just biology these days. We talk about the biopsychosocial model, and this is a model where we try to include psychology and social factors in addition to biology when treating health. Finally, I want to leave you with a couple of definitions. Health psychology is devoted to understanding psychological influences on how people stay healthy, why people become ill, and how people respond when they do become ill. There are 4 areas of focus: health promotion and maintenance, prevention and treatment of illness, etiology and correlations of health, illness, and dysfunction. That's a fancy way of saying what are the causes of health and illness. And then improving the healthcare system and formulating health policy. And we'll spend a lot of time during this semester talking about each of these areas. I know that I've covered this material fairly quickly. It's kind of hard to do this lecture without the feedback of seeing if the class can follow or not. But I will cover all this material in more detail in class on the 24th. If you have questions, bring them to class, and I look forward to meeting you guys on Tuesday.